When I was diagnosed, I was 3 months postpartum, and I really had my world rocked. And it was really a wake up call to me that my body was out of balance. I also had a genetic mutation. And so that combination, I think, is what sort of fueled the fire of my cancer. And then there's the unknown, because we never truly know what causes cancer. We can only change and adapt afterwards. So this is a no shame, no blame situation. But for me, I found health through cancer. I changed my lifestyle. I truly found healthy living, and I learned more about healthy living, and I regained my vitality through lifestyle changes after a cancer diagnosis. And I found that it was, like I said, the wake-up call to choosing healthy lifestyle options that actually got me through some of the toughest times of cancer too. So it was the instigator for change that I did not ask for, but I'm very grateful for some of the lessons that I've learned along the way.
So, Dr. Lucking, we talked a lot about how the power of movement can help you through navigating cancer, chemotherapy, radiation. Can you elaborate on that more?
So movement is really good for the mind, body, and soul. We know that exercise has amazing anti-cancer properties. It reduces inflammation, helps to regulate insulin and blood sugar levels. It also helps to deliver chemotherapy to the tumor, and doing so by promoting blood flow, and can make the tumor more responsive to chemotherapy by reducing hypoxia. And it also boosts the immune system, and then it makes us feel good, improves mental health and well-being. And it also helps with sleep. Some studies have shown that it may even make chemo more effective. That's still being investigated. One thing I like to think about with exercise is that when our muscles are moving, they're actually releasing little chemicals that are called myokines, and they are anti-inflammatory, and they help the immune system fight cancer cells. So it's amazing when you think about your muscle contracting and all these powerful chemicals that your body is innately just putting out into its system. It also helps to enhance natural killer cells to fight the cancer cells, and it reduces the pro-inflammatory fat that's in our body, and it protects the heart from the toxic effects of chemotherapy. And it also increases the innate antioxidant systems that are in our body and reduces oxidative stress, and then also can help with improving cardiac function, improving cardiac reserves, and reducing the heart strain. So all of these things are amazing when we think about doing the cardiovascular exercises, doing strength exercises, and then also doing stretching and mindfulness, gentle movements too.
Yes, and like we've talked about before, you can start very slow and very small. You don't have to go from doing nothing to 20 push-ups a day, or thinking you're going to suddenly be doing 100 crunches, because that's not what it's about. It's about like small amounts of change. And I wonder, do you find that people have more body aches or more areas that feel vulnerable after they do the exercise? Like, how do you have them navigate that? Listen to their body or try not to overdo?
And I think that's really hard too, because there are a lot of aches when you're going through cancer treatment. Menopause alone, there's a lot more body aches because there's estrogen receptors even in the joints. And so I think that it is really important to treat your body very well. So try not to overdo it, but also get a balance of exercises, not just running 5 miles a day. Whew, that's intense. And that's a lot of repetitive trauma in the same exact motion. So incorporating things where you're doing some strength training and some cardiovascular work, but then also taking the time, which is always hard, to stretch and just lengthen the body, doing things like yoga, doing gentle stretching. All these different things can be really helpful too.
Is there anything you have people try to avoid? I think about, even if you're navigating, getting your kids to soccer and their soccer bags and getting them in and out of the car. Maybe you have a baby, you're getting in and out of a car seat. Even those things could be very tiring and even injurious to the body when you're not going through cancer. So I wonder if you've seen that in patients that you're working with.
I mean, for sure. Yes, I think definitely those like twisting repetitive motions where you're at an awkward angle and you're lifting something up. That's when you really want to engage your core. And I think you can definitely do strength training of the core to help prevent those issues. Things like Pilates and yoga also are very core centric, and that can be very helpful too. And then also, I always say this for cancer survivors, like enlist help. Your community wants to help you, and it's important to lean on people for help too. When you're not at your strongest, August, when you're going through treatment, have an online spreadsheet or have an ongoing list of who can help you take the kids to practice, who can help you unload your groceries. Because these things are hard, and the little things that we do, especially as moms and dads, they do add up. That load is heavy.
Absolutely. And I do think that's something that's evolved that's been very helpful is people say, what can I do to help? And those who really take the time to make a spreadsheet or use some of the many apps to have food delivered to your house, to agree to take your children to soccer or drive them to school, it's amazing because no one wants to be asking for help every single day.
Right.
It feels painful. It feels like you're more fragile. I know no matter what you're going through, it's hard to ask for help. So it's great that we have these communities that are thinking that way. So tell me a little bit more about what Health Through Cancer has meant to you.
Great question. So for me, when I was diagnosed, I was 3 months postpartum, and I really had my world rocked. And it was really a wake-up call to me that my body was out of balance. I also had a genetic mutation. And so that combination, I think, is what sort of fueled the fire of my cancer. And then there's the unknown, because we never truly know what causes cancer. We can only change and adapt afterwards. So this is a no shame, no blame situation. But for me, I found Health Through Cancer. I changed my lifestyle. I truly found healthy living, and I learned more about healthy living, and I regained my vitality through lifestyle changes after a cancer diagnosis. And I found that it was, like I said, the wake-up call to choosing healthy lifestyle options that actually got me through some of the toughest times of cancer too. So it was the instigator for change that I did not ask for, but I'm very grateful for some of the lessons that I've learned along the way.
And how many children do you have?
We have 4 boys.
Wow.
Yeah.
A lot. Yeah. It's beautiful. It's beautiful. It's something to keep you going, but incredible exhaustion. I'm sure you must.
Yes.
And so how did it evolve into having Health Through Cancer and then now creating Better Together Survivors?
Yeah, so I learned a lot through my own cancer journey, and I learned about what adjuvant and integrative therapies that I wanted to use. And I learned a lot about how nature and sound healing and music and movement and nutrition were all very powerful tools that I could add to my traditional chemotherapy, surgery, and radiation treatment. And what I wanted to do was bring this to other people, because I found it was very empowering for me to go out and meet other people who are going through cancer too. But it didn't really resonate with me to go into the clinical setting. I tried to avoid going into the hospital more than I needed to. And so I wanted to find a support group that was in the outside setting, in the outdoor realm, away from the hospital. I went on cancer survivor retreats, and they were super empowering, where I met other survivors and we tried new things. And this was a great way to test my body and believe in my body again. Like, I tried surfing, and we went hiking together, and we did mindfulness meditations in nature. And then I also went whitewater kayaking. So these were incredible experiences, but the coolest thing was meeting other survivors that had common interests, and then laughing about our cancer and not feeling so alone. So I wanted to bring a small part of that back to central Pennsylvania, where I live. And so I created a nonprofit called Better Together Survivors. And we harness those powers of nature, movement, art, music, and mindfulness, and we do it in a way we can connect and have fun. And so that was my project this year, and we've had some great events, and really I'm just trying to grow our community so that we do feel supported, because we know that women who go through breast cancer who have more friends than when they started or the same actually have better outcomes. And so I took that information as power, and I said, let's actually implement it and do it right now. So that's what I'm doing.
That's awesome. It's the power of community. I can't wait till you host your first retreat. I can already envision what's going to be. And we have a joke in my family that I'm Spanish. My mom is Spanish. We come from a long history of criers, but we also come from a long history of laughers. I think just that when you're in a community like that, you're going to feel free and safe to shed tears, but also to be laughing and making fun. And I think about the things that we put patients through. They're sometimes so incredibly awkward things that people say, but now you're there sharing them together and can have those little off laughter jokes that I think empower you and strengthen you for sure. The laughter, nature, like we've talked about, all the things we avoid when we're just going to work and checking off our list that we're not able to do. So I love that you've created that. And I know we talked about supplements, and we talked a little bit in the past about what supplements you should go toward and maybe what you shouldn't do. But what are your thoughts on what are supplements that could be helpful when someone's going through chemo or even post chemo?
So one supplement that has been shown to be important is vitamin D. And as dermatologists, we're always recommending that people stay out of the sun and use really strict sun protection and sun avoidance, especially if they've had skin cancer. But studies have shown that women who have vitamin D levels that are low at diagnosis of breast cancer actually have slightly worse outcomes, and that it can be correlated with a higher risk of breast cancer to begin with. And so I think as dermatologists, it's an important conversation to have with your patients. Have you had your vitamin D level checked? And then it is something that's good to supplement. So that is one thing I do think is very valuable. And there is still some controversy about, is it the vitamin D? Is it the act of the sunlight hitting the skin? But at least for now, we are looking at vitamin D levels. So that's really important.
Yes, and I don't think we absorb vitamin D very well, and many people are low in vitamin D, so they can't get it as easily just through diet. And
Right.
one of the sources of vitamin D can be inflammatory, like dairy and milk, things like that. So I know that's something I'm conscious of with patients. We also know that some breast cancer patients can be more prone to melanoma. And so you really need to get your skin exam. We see a lot of people coming in getting a skin exam because they've been recommended to by their oncologist. And again, that's a time period for us to educate about vitamin D. I know you like mineral sunscreens, but also to calm them that every bump on their body is probably not going to be a precancer. I think we don't want to make people more fearful to come to the dermatologist. We want to partner with you to just give you assurance this is a good bump, bad bump. We can do an easy, small biopsy, but we can partner with your oncologist and with your community to make you feel like you're being taken care of.
It's beautiful.
So is there an ideal effective dose of movement during treatment? For example, walking 10 minutes a day or stretching for 20 minutes? What has been found?
So the main recommendation is to aim for 30 minutes of moderate to vigorous physical activity a day, at least 5 times a week. And so that averages out to 150 minutes a week, which can seem daunting for some, but it can be split up during the day. And so if you have 10 minutes, a quick 10-minute walk to the bus stop with your children or walk around the block while you're waiting for an appointment, you can split it up throughout the day. And there are some days where a very slow walk will count. Like we have talked about, if it's a really tough treatment day, maybe that is not a 30-minute day, and that is okay. It's important to have rest built in for our body too. And I also think it's important to highlight the fact that too much exercise is a real thing. 90 or more minutes a day has been shown to decrease the immune system. So I do want people to be careful because we don't want to just go so hard that then we're decreasing our own immune mechanisms. So there's a balance to that. And obviously the 30 minutes a day of exercise is for a general population. So if you are younger and premenopausal, you may need higher amounts of activity. And that was just a generic time frame that was quoted for cancer patients.
Oh, wow, that's great information. That's awesome. It's just amazing that these studies are even being done. We need more studies. We need more women's health studies for sure.
And I think that the misconception before was that cancer patients should lay on the couch. You should just eat whatever you want. And studies are showing that no, that's not true. Because when you're moving, it's going to help prevent some of the side effects from the chemotherapy. It's going to help just feel better. And then also what we eat is super important for both some of the side effects from the chemo, but also for how your body is using its own mechanisms to fight the cancer too. So it's changed. It's been a game changer in the last 50 years of oncology, both with the medications that are available and things we're using to mitigate the side effects and what we're doing for our own bodies, which is incredible. But as you said, it just needs to keep going.
Yes. And one of the other things I see is when patients will have medications that produce a lot of bruising. And that, again, can be disturbing because, again, it's an outward sign that you're going through treatment and people want to feel like they can be discreet at times, or maybe it's not their personality for everybody to know. And I have found that some of the new bruise creams have been helpful. For example, Skin Tensive that has arnica and vitamin K can be very helpful in gently massaging into a bruise. You can get the smallest bump on your hand and have a big bruise after having an IV or having blood drawn.
Sure.
It's been very soothing and calming and helps the bruise go away. So that's a great tip we can pass on to our patients. Can you share a story where a patient was transformed through movement and self-care during treatment with your suggestions from Health Through Cancer?
Yeah, so I have a friend who has transformed her life after her cancer diagnosis, and we shared a lot of the information that was on my website. And I would talk to her before or message her before her treatments, and she would be exercising before the treatment, getting ready for it. And then she also took a mindfulness-based stress reduction course, and now she meditates for 10 to 20 minutes a day. And she finds more wonder, awe, and joy in inspiring daily moments, and she's happier and less stressed. And she also reports that based on data from her fitness tracker that she's sleeping better than she did prior to cancer. And she just has revitalized and changed her life. Despite everything that she's gone through, she's kept going, she's adapted, and I think she's doing wonderfully.
Does she use an app for meditation or a process for guiding her through meditation, or do you have any
Yeah,
recommendations?
there is an app that she uses that I also use. It's called Insight Timer. And I like that one because it does have some healing beats on it too. So we talk about music and sound healing and how that can help to soothe the brain and change the brain waves. And they do have some of those recordings on the app, as well as meditations, yoga nidra, and other guided prompts, which I think are really great. And it's free. You can get a premium membership, but that one also is free, which I like sharing with people because I want to make this information accessible and manageable for everyone.
Yeah, that's wonderful. I think sometimes we need some guidance at first because people think meditation means that your brain doesn't have a thought. And I love that imagery that sometimes that's when you start making long lists while you're trying to meditate. But I love that thought that the thought is like on a cloud and you just let that cloud float by and keep
Yeah.
letting it guide by. And that I think can help you at night when you can't sleep. And whether you're going through cancer or whether you're going through sleep disturbance because you're going through a divorce or you've had a death in your family or menopause, but sometimes all those things are simultaneous in life.
Right?
So like you said, you should have been navigating postpartum issues and instead you were navigating postpartum and breast cancer.
That was a lot.
Yeah, it was a lot.
I was really grateful for my community and my family to help me get through all that. So that's also the reason why I wanted to start my nonprofit too, is I wanted to give people a community that they can lean on, because when we feel we are supported, we feel like we can handle the heavy stuff.
Yes. I have a question a little bit different than what we've been talking about. Do you have any thoughts on how your spouse, your partner navigates as they're watching someone go through all this trauma, this pain, and they're not who they were? Are there support groups for men or women's partners and how they're going to help through this?
I think that's very challenging because as the individual who's going through it, sometimes I don't see maybe how bad I look or how sick I seem. To me, you're just getting through it, buckle down, head down. But I think that they are also in charge of all the extraneous things, right? Like the food and the management and the day-to-day and the driving. And that's really heavy. And I think that seeking support is super important. Maybe it's not at a support group through a hospital. Maybe it's through an outlet that you already have, like a soccer team that you're a part of, or a family unit that you're really tight with, or neighbors. But I do think that's really important because it affects everyone differently. Everyone in your circle is affected by this huge life quake. And there are also certain organizations that do support partners too. Some of the cancer venture camps I went on, they do have one for partners and survivors. And so I can provide some links in our chat as well about that too, because I think it is an under-recognized need, an under-recognized group. And we all deal with cancer together. We're not islands moving through this.
Exactly. Yeah. And not to stereotype, but many times men have not been taught to ask for help. And they might have a close friend that they talk to, but they don't know how to express that vulnerability of how bad it is. And there's an uncomfortableness. But I think there are a lot of men that are finding that getting this support is helpful. They want to be a better partner. They want to be able to be vulnerable when they see that pain that their spouse is going through and hope for better times.
They're expected to be the strong one sometimes. So it's hard to share that vulnerability and emotion when you're trying to juggle all the things and expected to be the one who's well and capable. But it's important to let down and let go a little bit too.
Yeah, it's wonderful. I know that you can just feel like you're not yourself, and your self-esteem is so threatened and changed, and who you are is threatened by going through this experience. What did you find helped you the most while you were going through your journey?
Oh, that's such a difficult challenge. But I think give it time and space that it needs, and validate these feelings. Of course, you're going to feel disconnected from your body after chemo and surgery. Your hair is gone, your weight has changed, there's new scars, there's loss of important tissues. And I think it's important to validate how challenging this is. And you can discuss this with a trained clinician, such as a psychiatrist, a therapist, especially those who work with cancer patients. And I also think it's important to talk to loved ones about it and other survivors. And there is a group called Immerman's Angels, and they actually connect survivors with other survivors across the country who are age matched and diagnosis matched. And I think that's really helpful to have that person who's been through what you've been through, and they can lead you and talk you through it. And then with persons like that, you can laugh and laugh until you cry, like you said. And that's really important and healing. And then also trying new things that you haven't done before cancer, challenging your brain in new ways, new crafts, new activities, and new adventures. Maybe try hiking out in nature, which was known as feeling very healing. For me, I did some things like crazy that I never would have done before cancer, like surfing and jumping off a waterfall and going whitewater kayaking. And this is something totally outside my normal worldview, but it was a way to challenge myself and say, yes, I can do things again. I am brave. My body is capable. And really stepping into that I've overcome this and now here I am. And that's a really great feeling.
Yeah, courage, adaptability, taking a
Yeah.
new leap. Literally, I'm not leaping off of a waterfall, or I'm not skydiving. I'll do surfing and other things. But I think that's really great. Maybe you could have a karaoke night, overcome people's biggest
Yeah, that's a
fears,
great idea.
to sing in front of others or to tell a story in front of. I know storytelling is super important too in
Yes, it
healing.
is.
That's great.
Yes, it is.
Well, this
Thank
is
you for giving me this
wonderful.
forum today. And I think too, like reclaiming your scars too. There's an organization called P Inc. where women can get a bra tattoo over mastectomy scars. And that is a very beautiful way to reclaim your body too. And that is a free organization. We can provide that link in the website too.
Oh, I love that. I remember there was, maybe he's still working, a tattoo artist in Maryland, I'll get his name, who was just a master at recreating the beautiful coloring for each individual of their nipple when they didn't have and that was so important to many of my patients. And everybody's different. It's totally a personal readjustment to how your body is now. Thank you
Right.
so much. That's great.
Thank you. Thank you.